Thank you for the introduction, Tony, and thanks everyone for coming. As Tony said, my training comes out of Canada, so a lot of what I talk about is very much within the Canadian context, where in fact they have been using what they call knowledge translation for over 15 years. It's an integral part of their funding. Everyone who submits a grant for health or medical funding must submit a translation plan that takes them all the way through to implementation and the measurement of research impact. And having trained there, I thought, why don't we do it here? So this is something I'm very passionate about. It's something I've been working with lots of different people and funders to try and make sure that we can embed this in our processes so that we can get to having more impact. And as I think it was Raj said, the implementation piece is a very important part of that. And when different people talk about translation, we could ask everyone in the room, you'd all have a very different idea of what you think translation is. It's not to say it's right or wrong. I like to present translation as an entire system of how we go from the very beginning of our creation of our research all the way through to the delivery of that into practice in a way that people can use it. So as Tony said, there's a lot of terminology around this and it can be really confusing. So I wanted to just start off by saying, don't be too confused, but there are over 91 terms used for translation. In fact, in health and medical research alone, 52 terms. They don't necessarily all mean the same thing to each person. It depends where you sit in the world, the type of research that you're doing as to what the terminology might be. But you may have heard of terms like knowledge transfer and exchange, implementation science was mentioned, research translation is the one that we're using today, knowledge translation is the one that I use, knowledge mobilisation, engaged scholarship. It goes on and on. There are tons of terms. People break it down and it means different things to different people. I wanted to give a couple of definitions, and this one's from Canada. I like it because it's just common sense. Moving knowledge into active service for the broadest possible common good, and that's what we all want, right? We all just want to make sure that what we're doing is good for everyone. But the other one is the World Health Organization definition. They developed this definition in 2005, and their definition is based on the Canadian Institutes of Health Research definition, which was developed in the year 2000 when they started to mandate knowledge translation into their health funding system. The reason I prefer the term knowledge translation, just as a little aside, is because I don't believe that everything that we should implement comes from research. We all have knowledge. We need to take knowledge from service delivery. We need to take knowledge from policymakers. We need to take knowledge from people with lived experience, the nurses working day to day in the hospital, and we need to blend that with our research knowledge and the knowledge from the literature to be able to come up with really great solutions, rather than the research push kind of model that we can sometimes see. So translation is made up of a whole bunch of things, and I'm going to walk you through a model in a moment that will show you how it fits together as a much broader system. And the way that I talk about translation is much more of an integrated model. You can take a piece of research and say, okay, we've created clinical guidelines, now let's implement it, or we've got this research knowledge, let's do something with it. And that would be considered an end of grant translation effort. But if we use an integrated model of translation, we have a lot more success in getting the people who need the research to be involved, and we have some buy-in then from different agencies and organisations. So when it comes time to implementing, everyone's on the same page. There's probably been resources created to do that, and we know it can happen. We've addressed any barriers and we've looked at the facilitators to help us get through those processes. So translation includes all of the steps between creating the knowledge and delivering it, making it into an application or doing something with it. It needs multi-directional communication. So I like to talk about knowledge being exchanged between those end users, between the people who can help us to develop relevancy of what the knowledge should look like, how it needs to be implemented, how it's best to be delivered. It's interactive, it requires a lot of collaboration, and different activities, and really thinking outside the box in how we deliver things, rather than this, we've written a clinical guideline, here you go. Well, how do you then take that and put it into practice? And unfortunately, we know clinical guidelines, 8% uptake. It's not great. We need to do more to make sure we can do that. And most importantly, it is impact oriented. So with a lot of talk at the moment in the research sector about research impact. And I often have researchers say to me, how do I get to impact? Or how do I measure my impact? And I said, well, what did you want your impact to be? What did you set up when you started your research? You know, what were your goals? Did you plan for this? And no, you have to know what it is you want to impact in order to get there and to determine it. So I want to walk you through what I've developed as a system of translation, and this is based on several different models of translation. There are a lot of models and a lot of frameworks out there. Okay. So this top line really is the research process. And I like to start with this because I train a lot of researchers, and I like to embed it in a way that researchers can say, oh, okay, this is how it fits into the normal research process, because I've found that if I make it a real add-on and a real on top of process, no one wants to do it. Unfortunately, I have to lean over here. So firstly, we start off by creating questions and methods in the research process, and there's the normal way of doing that. You go to the literature, you work out what you've previously done. But in order to do translation, we need to make sure that we consult with the end users of the research and with other stakeholders. But we also need to formalise some partnerships and collaborations with those, and it doesn't need to be, you know, mum and dad. It doesn't need to be necessarily the very end consumer, although they should have a voice, but it needs to be that middle party. If you're doing clinical research, of course the clinicians need to be involved, probably the heads of hospital, probably the nurses who are delivering some of those services need to be involved in what works in practice in that setting. And at this time you can also think about what are the barriers. If we find what we're looking for, what are the barriers to putting this into practice? What's happening at the moment in their work circumstance? Is there a political barrier? Are there changes in staff? Do they not have the knowledge and know how to do this? How can we start to think about approaching these things as we go through that process? Because research takes a long time, so you've got time. But right up here you need to create some buy-in and get some feedback as to the relevancy of the work that you're doing. Then during the research process, you need to continue to manage these relationships. And that takes a lot of work. So you need to set up systems where you can have ongoing feedback. It might not just be meetings. I've spoken to a lot of people who've said meetings are a waste of time because often everyone turns up to the meeting and it's just a bit of a talk fest. And so it's about having meetings structured that are important and meaningful and relevant at that time. Or it could be that you don't have meetings. It could be that there's some type of online platform that you use to share information. Be savvy about what that might be. But we need to make sure that we are managing that so that we don't just turn up 4 years after we start our research and say, here you go, here's the report. And then we end up with the knowledge from research. And this knowledge has come from the research, but it's also the knowledge that we got from the stakeholders and other people involved in the research. And there are two things that we do with this. We disseminate the knowledge, or we can use the knowledge, depending on what we have and how it's relevant to whatever we want to deliver. And in disseminating research, obviously we have publications and we have conference presentations that happen from research, but we need to do more. We need to think about how we can leverage social media and maybe other media to get our messages out there. We need to think about plain language summaries and how they can be really powerful for sharing small amounts of knowledge. And some people do this really well already, but for the most part, it doesn't get done for a lot of things. The stakeholder feedback, maybe you want to have a public seminar or an information session, maybe you want to create an infographic or develop something else that puts the information out there in a really easy way. But I always get asked, how is translation different to communication? And that's really interesting. When we disseminate in translation, we need to make sure that we measure the impact of the dissemination. And this is how it becomes translation, because we know then that people were able to use it or that we created change from our dissemination. So, for instance, if you have a public seminar to disseminate your information, how can you measure that that was effective? Well, firstly, you want to know who came. So, for instance, we want to know who's in the room today, what organisations they're representing, what they're doing here. But perhaps you could build in a post questionnaire. You could do a live online. There's lots of tools now you can use where everyone in the room can be on their mobile phone and they can punch in answers to a live poll as you're going through, so you can get some feedback that way. It might be that you send out an email later with a survey saying, how did you find that presentation? Did you understand it? Was it relevant to your work? Were you able to share this with your colleagues? What more can we do to make this easy for you to understand and to use in your current context? This is what makes this dissemination effort into a translation effort. So that's just one example. So the other thing we can do is we can use our knowledge, so we can get to that implementation piece. We need to work out what the implications of the knowledge are. We need to say, well, in the context of whatever area we're working in health and medical research, how does this fit? How does it fit with other research? How does it fit with someone's work context, their local service delivery context, or whatever that might be? And what value can this new knowledge add to that? So then we get to the implementation piece, and there is implementation science. And implementation science is its own thing, but implementation science sits in the translation pathway. You can't implement unless you set up all the other processes. You need to have the buy-in from the stakeholders. You need to have something that's relevant. Otherwise, you've got nothing to implement. You need to have those relationships with the right people. And so some of the examples are, the commercialisation of new products. But some of the harder things are the clinical practice guidelines, changes to service provision, changes to policy. These things are not so cut and dry. Commercialisation, people get money, big companies often will pay for that. But it's the social impacts of changes in behaviour, changes in delivery of services. These are the ones that we need to really focus on, as well as the commercial impacts. So once we've implemented something, we can start to say, okay, let's see if we had an impact. So we're measuring impact both from dissemination efforts and from implementation efforts. We need to know if what we implemented had an effect. What happened to that? And this impact will influence whether or not we do more research. So if you didn't find what you were looking for, that's okay. It means you're going down the wrong path, you choose something else. It still tells us what we should be looking for. And impact, most importantly, is measured at the level of the user. So we need these relationships with our partners and collaborators so we can measure our impact at that level, whether it be service delivery or policy or wherever. A great quote is that impact shows that people knew what to do with the knowledge that you shared. And that's from my colleague in Canada, Melanie Barwick. And I really like that quote because it does show that people knew what to do. But we need to make sure that we share not just a 400-page report, that we implement something much more tangible and in a way that people can use. So this is the overall system of translation. As you can see, it involves a lot of different elements with partnerships, with the buy-in from different groups, collaboration, managing of relationships, dissemination efforts that can have an impact measured. We measure the impact of our journal publications. Why not measure the impact of our other dissemination? And you can see that implementation science sits very much in this framework of translation, not as its own add-on to the end of research. And from that we can see how if we do all of these things and we manage all of these relationships and we get to implementation, we can start to think about the impacts that we're having and how we might measure those. So just to wrap up, my key messages to you are to think of translation as a system, not as a one thing that we just have to push our information out. It requires partnerships and collaborations. Impact requires planning, and that's why, as I was saying before, in Canada, they talk a lot about translation planning, which some people might call impact planning, but it's planning to where you want to get to in the end. Impact is measured at the level of the user. And I like to think of translation, because of my model and because of the way I like to think about it, I don't like to think about bridging a gap because I think it's just too one way or just the pulling and pushing. I like to think of closing the loop, and that we need to do all of these activities in order to close that loop, to continue to do relevant research and to continue to have impact on people's lives. And that's my presentation. Thanks.